Thank you, Dr. Cecula, for joining us here today. You were our featured guest on our Women's Weekly Health Tech session back in February. So that is out on YouTube, and I encourage everyone to go check that out after we have our conversation here. But for those who maybe didn't catch that, can you please give a brief introduction to yourself and Dama Health and maybe focus on the mission and vision for Dama Health?
Yeah, of course. And thank you so much for inviting me. So, hi, everyone. I'm a physician by background from Imperial College London and now a co-founder of Dama Health. And Dama Health is in a very big, bold vision to solve the trial and error of prescribing in women's health. And we believe that the future of women's health is really personalized, which means taking decisions about health and really treatments that really take into account all individual factors about that patient to minimize side effects of treatments and optimize health outcomes. So very big and bold vision, as we are all, I guess, in this sort of health tech community, thinking really big about the future of women's health.
Yeah, absolutely. And then what does Dama Health do, or how does it help patients and providers today?
Yes, of course. So we're starting to tackle this big problem into actually smaller chunks. So we started with contraception trial and error, and we started with contraception because it's such a common problem. So nearly all women use contraception at some point in their life. And on average, we try 3 to 4 different types before trying and finding the right one. And in the meantime, as we are on the wrong one, we suffer from side effects. So things like mental health problems actually are quite common, irregular bleeding, headaches, like things that really impact quality of life, health, also work and school as well. And it's really, really important, specifically for patients who actually use contraception as treatment for conditions such as PCOS, endometriosis, and other menstrual health problems as well. So our first product is actually a software platform that is looking at patient individual factors. It's around 150 data points to make the best recommendations of something that matches their lifestyle, their goals, their medical history, to find something that is most optimal to them. But actually, we're very committed to the future of this problem in terms of how can we predict who is likely to respond to contraception well, who's likely to develop side effects. So we are looking at biomarkers as well and genetic data as well to really be able to really tailor the prescribing and formulations and find the right match for the patient. So right now, the software platform is live in clinics, and we have patients using it as a decision support tool, helping them narrow down the options and find the right one. And it's helping providers as well streamline the consultations, make that shared decision with the patient. So it's already happening. We're collecting real data on patients as well to really be able to target the data gap as well, and really collecting the information on women's health experiences with contraception. And as I mentioned, doing the genetic research, and over time, we hope that we will be able to incorporate those novel findings and then genetic findings into these algorithms to really make those algorithms even more personalized as well, which we believe eventually will really lead to improved health outcomes for women around contraception.
Yeah, that's amazing. Thank you for sharing that. And I just want to talk about, as an advocate for women's health yourself, what initiatives or projects are you passionate about, and kind of how do they align with your personal values?
Yes. So where do I start? Again, generally my North Star, I think I could start a founder. You're always very enthusiastic and optimistic about a lot of things, but I really believe that we are moving towards that more personalized, preventative, proactive healthcare. And we are really seeing this across different areas of medicine already, but I really hope we're going to see more of that in women's health. So really everything that's as already mentioned on today in terms of early diagnostic, prognostic preventative algorithms as well. And I'm particularly excited about the longevity space as well, and looking at ovarian aging. So there's companies and researchers really looking into menopause and really researching this more and actually making menopause optional one day. So very excited about the very futuristic things as well.
Yeah, that's amazing. And then with regards to connecting and getting people engaged with Dama Health, what would be your call to action? Where can people learn more, or how can they engage with Dama Health?
Amazing. So finding us on LinkedIn, just emailing us, that's completely fine. So call to action, a few things. So we are always looking to speak to women and providers as well about their experiences to just learn more. The product is now live in clinics, so always looking for clinical partners as well that want to use the product and elevate the patient care, make it more personalized. Research partners as well to help us with the genetic research as well. But also we're fundraising our seed round. So if any investors are on this call, I'd love to speak to you guys as well.
All right. Well, if there is anybody on this call that wants to learn more, again, I'll point them in the direction of our YouTube channel. Watch the Women's Health Tech Wednesday for a lengthier interview. We appreciate your time, today, and hopefully we hear from you again soon.
Amazing. Thank you so much for having me.